Sat Sri Akal, Namaste, hello, and welcome to the show called The Truth Tribe. This is your host, Ravi Tur, and today we are talking about community work, social work, mental health, and not for profits. And for that, we have just the perfect guest, Mr. Gary Thandi from Moving Forward Family Services. Sir, welcome to the show.
Thanks. Happy to be here.
Pleasure to have you here. Mr. Gary Thandi is a force of change and empowerment, playing a pivotal role in reshaping the narratives surrounding family services and mental health support. Gary has 20 years of experience, having worked as a probation officer, counselor, hospital social worker, program manager, researcher, clinical supervisor, and executive director, where he's performing in his current role at the Moving Forward Family Services, which he also helped found. It provides low barrier counseling and support services to residents of Metro Vancouver and all over Canada. It is a mentorship agency which is run by new graduates beginning private practice. Understanding the multi layers of social, emotional, and cultural challenges that families often encounter, he's championed a holistic approach that's both sensitive to diverse needs and proactive in its outreach. Gary's accolades, however, aren't confined to just the academic prowess and leadership roles. They're also mirrored in the countless lives touched, transformed, and uplifted by his dedication and service. Super excited to talk to you about all that, sir, and much more. To start us off, though, in your words, who is Gary Thandi and what do you do?
So I was born in Campbell River, BC, small town on the island, and I still like to think that is home for sure. And I've now been living on the mainland for over 20 years. But really, who am I? I just think someone that genuinely cares for others and just values what people can do when they come together to support those that have had more privilege to be able to support others who may not have quite the same privileges. I'm a father, and that's a huge role for me for sure. It's something I'm very proud of, and a son. And so all of us multifaceted roles, but the ones that I'm most proud of is just those kind of relationships I've been able to build up.
That's good to hear. What formative experiences put you into the social work field? What is the most that you like about your role today?
I'll be honest, I've always been fascinated by human behavior and just sometimes why we do the things we do, why I do the things I do, and I reflect on that. And so when it came to choosing a career, I think I was more naturally a sociologist in many ways, but at the time I thought, I don't, there's maybe not so many opportunities there other than academia. And so I happened upon social work, which was to some degree similar in terms of learning about human behavior and human psychology, but also the programs would have practicums and work experience. So I went that route. And then from there, just discovered how it very much resonated with my values around supporting folks and building and uplifting families and communities. And so that was the path I took. And it wasn't a linear path. I tried different things and I dropped out at some points and then did some volunteer work and that became more aware of what my interests were and then went back to school. And I just mentioned that because that's even something I tell many people. Whatever you're going to do, it's your career, it's your passion. So you want to make sure that it's a good fit, right? And not necessarily think this is what I'm supposed to do or maybe what my family wants me to do. It's got to be something you want to do because you're going to spend a lot of time in it. And so take the time to try to discover what your interests are and how you want to proceed.
So, in a world which is run by profits and corporations, how did the idea of moving forward family services came about and what sort of inspired you to start this organization?
Oh, we could spend a long time on this, but I'll try to make it succinct. Like the bio that you provided, like all those different experiences I had. Part of the reason I had those experiences is I would do a certain job for a while and then I would reach a bit of a wall and feel like, okay, I feel I've been impactful, but I feel like there's so much more I can do and maybe look for other opportunities. Yet everywhere I went, I often encountered the same thing, which is the needs of who we were working with was often greater than the resources we had. And we often, again, everywhere I went, we all talked about the need to work more collaboratively and holistically in supporting not just the individual, but their families and even their extended families and their communities. But I was just increasingly discovering that our systems were never really set up to do that. And they're very individualistic. They're very specific on what they can do. And that's still, like, I'm grateful that we have the services we have in Western Canada, but there was gaps. And as I would I had an opportunity to do some research and I was reading about that as well. And so much of the research would be identifying these same gaps. And so I just kept wondering if we've all said that these are the issues and the evidence and the literature says these are the issues, then why is it not happening? And my own observation is again that the systems were set up a certain way many decades ago to meet the needs of a particular kind of community. And our communities have just changed so significantly and have become so much more diverse and complex in their needs, and our systems haven't kept up. But one point I was almost not ready to walk away, but I was becoming increasingly disheartened of I was at an agency that I think does good work, but they have a certain funding parameter that's been set. So they have to follow that and they have to work with the clients that's been identified for them to work with. And so we were often just turning so many people away because they didn't fit all those check marks. And even if they fit all the check marks, we were often putting them on huge wait lists because again, the resources were not anywhere near the need. And so I was becoming really distressed. I was struggling, knowing again that when somebody reaches out for counseling, for example, or any kind of help, it's usually because they've reached a place where they're struggling significantly. So there's already often a lot of harm that's taking place to them and their families. And then to be turned away or to be put on a huge wait list, we're almost saying you're not that important. And that I just struggled with that. And then simultaneously, I had this great experience where I had great mentors when I was doing my bachelor's and master's in social work programs. So it was always something I was really keen on doing. And I started to notice that these students with the right support, so these are students on practicums from these accredited institutions, they're doing amazing work. And so I decided I'm going to have them provide a lot of this service because otherwise people are just falling through these huge gaps. And that's where it all came together. My own frustrations or all my own distress, I call it moral distress of knowing just how much suffering was happening and how we increased the suffering by turning people away or putting them on wait lists. And that seeing this amazing resource that could actually address that need and not turn people away and not put people on huge wait lists, and even having folks that speak different languages and come from different cultural communities, because that's something else I've noticed over the years is just how poorly serviced many of our communities are, including South Asian, but certainly not limited to South Asians. As much as there was frustration and distress, there was also excitement and optimism that there was the potential with this working with students and mentoring and supporting them that we could actually make some tangible differences. And doing it as a nonprofit, it was important because we wanted to be accessible and we could try to do it as a clinic, but there's a lot more cost when you're for profit. And so that was the route I went. I still think nonprofits have some work to do, but I think that there's some areas there that can be improved upon, and we're hoping to lead the way in that regard too. But yeah, that's why I settled on providing services to moving forward.
Very interesting. I love how you turned your adversity into an opportunity and just ran with it. So that's inspiring. The mechanics of moving forward family services. Can you provide me a breakdown of how the organization is set up today and who are you supporting?
Absolutely. So again, going back to some of those kind of opportunities to reflect before I started, I recognized that a lot of the students, including myself when I was a student many years ago, were given great training in working with lots of different populations, often children, youth, adults, seniors, families, extended families, working in substance use, mental health, intimate partner violence. Like we get these great trainings in schools, but then we have to go into a field that limits that. It says you need to work either with adults in mental health or children in mental health or school counseling. And again, I understand that there's different ministries that are funding those and they have different criteria on who gets service. But I saw it as a limitation. And I saw us as an extent, what I often say is an extension of the classroom. So if people are given this great training, then we're going to give them the opportunity to work with any population they're interested in. Again, getting the supervision and support and even getting training, additional training. So that was really, I think, a big part of what Moving Forward does is we'll work with anybody. So if you reach out and you want counseling, it is still counseling. We're not doing like job training or there's a lot of folks doing that and they're doing great. And so I recognized there was a huge need around mental health, substance use, domestic violence. And so we were going to provide counseling. And it was this idea that there's no wrong door. If you want counseling, regardless of what it's for, regardless of your age or your identified gender or your primary language. We're gonna support you, right? Like we're not gonna turn you away. And so it was really recognizing that again, when people are struggling, they don't need to be like bounced around all over the place or told they're not eligible here, so try there, and then they're turned away there. Again, these are all just debilitating experiences. And again, I was struggling with that. So I refuse to do that. So we are a one-stop shop in that way around mental health. If there's a family or extended family coming to us, we will do everything we can to support each and every one of them. And COVID obviously was horrible in so many ways, but in one of the few positives for us as an agency, it made us realize that we could do therapy online as well. So we have space in Surrey, BC, where we can see people in person. But once COVID hit and things were shutting down, we shifted to the online platform, and now we continue to do online services for anyone who prefers that option or anyone that's not anywhere near the Lower Mainland or in other parts of the country. It really just was that. Another term I often use it, we're innovating by simplifying. We're just saying, let's not put all these different criteria as to who gets a service or all these kind of hoops that people have to jump. Let's just support them. And if we're not the best fit, then let's find the best fit for them.
So, how many folks do you have involved with your organization today in terms of practitioners? How many clients you're serving today? Is there a number on that?
Well, yeah. So going to the online platform, we came across this great database that's fully encrypted and meets protection of privacy kinds of expectations and regulations. And it allows us to better see like our stats. And so we're at around 2,500 active clients in a month. And then we have at any given time about 125 students with us, practical students, who I'd like to think, and this is what I hear, they've come to us because they hear what we're up to. They see the flexible nature of the work we do. They see the opportunities they can receive if they come to us. And it's something I didn't plan on. I didn't plan a lot of this in many ways. Originally, it was just me and a few students that I was supervising. And then I had many people that had similar perspectives that joined the agency and they started contributing their skill sets in terms of supervising. And then over time, as we gained a bit of momentum and hopefully I'd like to think a good reputation, we started getting a little funding support or philanthropic support. So I was able to contract these supervisors. So we have 20 clinical supervisors on some contracts that will supervise all the students, again, around 125 students across the country. And then again, the part that I didn't anticipate, again, a lot of it I didn't, but was a lot of the students, once they graduated and they go into the field, that they very much still valued what we were doing. And so they circled back and then they will contribute and they will do sliding scale. So we have clients who say, I don't really want to work with a student. I think my needs are too complex, but I can't afford private therapy, which is around $140 to $150 an hour. And so there's a lot of great people doing private therapy, but it's just not accessible to a lot of people unless you have a great insurance plan. And a lot of us don't, frankly. Or if you're a high income earner, and even high income earners, when you look at cost of living, it's hard to find an extra $150, even though it's so incredibly important to take care of one's mental health. I understand it's just not feasible for a lot of folks. Our private therapists, so these are fully registered, will offer lower fee. We say $50, right? And that seems to be a fee that works for a lot of people. They don't want to work with a student thinking that maybe they're too new to work with, then they can work with those private therapists. And that fee goes right to the private therapist. Like I often say, I didn't do this as a business, and I don't think I'm a very good business person because I'm not looking at those kind of opportunities to make money. I think these are great therapists that are willing to charge way less than they otherwise would, but they recognize as well that these are clients that can never afford $150 an hour kind of thing. And yeah, I'm happy that client can just work with them and then pay them directly and we can facilitate that process.
Through this work of yours, what has been your most proud moment or your highest point of making a change in maybe a particular individual's journey? Can you share such an example with me?
Oh, absolutely. Despite, I think, being, I would say, the busiest nonprofit counseling agency in the country, we're fairly close and having minimal bureaucracy, which I don't care for. I think there's a bureaucracy is good if it's around infrastructure and ensuring quality controls, but I think it's excessive in our world and it's getting in the way. Like the things I described, like having very restrictive criteria as part of bureaucracy, things moving slowly because you have this chain of command and often people can't make decisions. So they have to go up the chain of command. I get some of that, but I also feel that's why progress often is very slow and change is very slow. I love that we can operate outside that system, right? We're not funded by any of those traditional government sectors that are responsible for publicly funded counseling. So I don't need to deal with their bureaucracy. I wish they would fund, given they send a lot of clients our way, but at the same time, I love the fact that we can just operate in a way that's very much evidence based and very much ethical and moral without getting caught up in some of those systems that I do question and question sometimes their morality and their ethics of how they operate. And so that I appreciate, but even in a more simple way, I appreciate when somebody reaches out and says, we have this person that's really struggling. What can we do? And it's certainly not just me. There's a lot of great like-minded folks. Between 3 or 4 of us, on moving forward, we'll get the counseling set up within days. Those other individuals might be able to support them around housing or around getting them connected to like food and groceries. And those experiences, they happen often, to be honest, but we bypassed so much just to get this person connected because they were suffering. They didn't need help 6 months from now. They needed it today. And so those kind of experiences I love. The other piece I love is the students that I hope that come to us. I try to say, yes, when you're when you're new in the field, say you graduate and you get a job, you're not going to question things because you can't. You're new and it may not be received well. But what I hope they will do is keep an eye on things. Don't just assume that the way you've been told to do it is the best way. I'm not saying it's deplorable, but I think it's not necessarily the most effective way. And so keep an eye on that, keep observing, get your experience, get your own observations. Don't just take what I'm saying, develop your own impressions. And as time goes on and you establish yourself, maybe you can start to affect change. I'm done with that. I've been in that system and I don't want to go back into it. Again, there's a lot of great, but I feel more effective outside of it. But true change happens from people within. And so hopefully those counselors and social workers that have come to us see that it's okay to challenge things. It's okay to advocate. It's okay to question things, but obviously do it in a way that you're not putting yourself in a vulnerable position.
Absolutely. I love the point that you touch on there is to always be curious and always ask questions and always try to improve and look for that outlook. Um, I want to just turn gears here and talk a little bit about mental health. Before I do talk about mental health, the hows and the what's of it, I want to shed some light onto why mental health is such a big issue. So I have put together some numbers here. This is a report issued by Canadian Mental Health Association. I think these numbers help paint a picture in the dire situation the country is today. So the report says in any given year, 1 in 5 people in Canada will personally experience a mental health problem or illness. By age 40, about 50% of the population will have or have had a mental illness. Major depression affects approximately 5.4% of the Canadian population, and anxiety disorders affect 4.6% of the total population. About 1% of Canadians will experience bipolar disorder, and another 1% will experience schizophrenia. Eating disorders affect approximately 1 million Canadians. They impact women at a rate 10 times that of men and have the highest rate of mortality of any mental illness. Substance use disorders affect approximately 6% of Canadians. 4,000 Canadians die by suicide every year. Suicide is the second leading cause of death among youth and young adults between 15 to 34 years. The mortality rate due to suicide among men is 3 times the rate amongst women, but girls and young women are 3 times more likely than men to harm themselves and be hospitalized from self-harms. When it comes to mental illness, youth is a critical period. Most people living with a mental illness see their symptoms begin before age 18. Approximately 20% of Canadian youth are affected by mental illness or disorder. 11% of 15 to 24-year-olds reported experiencing depression. In Canada, only 1 out of 5 children receive appropriate mental health services. When you hear those numbers, is that the accurate representation of what the ground reality is as to what?
Absolutely. So it goes back to what I said. If we know this is the reality Yes, we need more resources, but maybe we also need to look at how those resources are distributed and what we're doing with them. And as I referred to, I think bureaucracy, I think systems that don't meet the needs of today's communities is a big problem. So I don't think it's just a money issue, but absolutely. I think 100% of us will have struggles, right? So these are talking in many cases about diagnosable like depression, meeting a certain diagnosis. But there's this great quote, like none of us are going to get through this life unscathed, in that we're going to have experiences of grief, loss, maybe a loss of a relationship, loss of friendships, loss of a loved one. It's going to impact us, right? And we know now, and we probably know for some time, like the impact even of physical health issues and how it impacts our mental health. So they're so connected, and how we've often been socialized to say use substances or drink alcohol as a way to cope with stress and how harmful that can be. And yet those are the kind of things we've been doing. And so, yeah, it doesn't surprise me. I'm familiar with a lot of those stats. And yet I always think, like, if we know this, then why can't we get in front of some of these issues? And that's part another observation I have is our systems were set up to be very reactive, right? Usually something is only funded when it reaches a bit of a crisis, like the opioid issue being a prime example. But even before that, we had in our community and others as well, but like the youth violence, it shouldn't take so many lives lost before attention is paid to something. But that's ultimately what it is. As much as we know the value of early intervention and prevention, we unfortunately don't do nearly enough of that. And I respect what schools do and teachers do for sure. But we've known for a long time that we need to do more of this at earlier ages, yet it's not happening in any kind of concerted way. Again, I'm not blaming teachers or schools even because they have so much curriculum to teach. But these are curriculum, again, that have been there for decades and they remain, and it's hard to shift that, even though we know maybe we need to teach more on how to manage your stress, how to manage your anger, what are healthy relationships, and how to develop those kind of things, right? I have two boys, and one's in high school, one's in post-secondary now. And I would hear sometimes in their classes they did something around mindfulness or they learned a bit about this. So I'm not saying that it's not happening, but it's not happening anywhere near where it needs to. And so that's the tough. Again, in my experience, changing the status quo, changing what's always been done is incredibly difficult. It can happen and it needs to happen. But again, like I said, I don't have the energy anymore necessarily. I'll do it from more the outside, but I hope there's lots of people that are still able to do it from within because it's so necessary.
So, for the people that you're mentioning here from the outside listening and who want to make that change, if you have to list the top three changes that are needed and that would improve our situation, what would those three changes be?
I think the systems need to recognize. Here's what an example what I would often use. Say there's a family, and let's say South Asian family, and maybe that say there was violence, the husband towards the partner, towards the wife. Of course, there's no excuse for that. That's not acceptable in any way, shape, or form. But maybe there's intergenerational traumas that are underlying some of these issues, right? Maybe there's untreated mental health and substance use. Our system basically will say, okay, dad, you go through criminal justice. Mom, you go through victim services. Kids, you go through Ministry for Children and Families or school-based services. We individualize these families that would have benefited from more familial type of supports. I'm not saying bring them all together and work with them as a family because there's different dynamics, but having a one-stop shop where they can go, where dad can get certain services, mom can get services, kids can get service. Because if they've chosen to stay together, then we need to figure out ways to work with them in that way. And quite often they do, but our system individualizes them, right? And again, we wait until that violence occurs or that situation occurs. But if we were more proactive, maybe we could have prevented some of that in the first place. And so our systems need to work more closely together. But again, I've gone to meetings where everybody says that, and yet it's not happening, right? So I feel like there's something more that needs to be done, more oversight. I used to say we need to get our health authority people, our ministry people, our education people in a room and not let them out until they basically develop a plan on how to work together. That's not ethical. That's not legal, but it's just this idea that talk is cheap. And too often that's what it is. There's talk, right? The other thing I'll say, and it sounds like I'm getting jaded, but I'll be honest, it's my reality, my experience, is a lot of people are speaking the rhetoric. A lot of people, especially even this day, they're talking about anti-racism, gender-based applying gender-based analysis, equity, diversity, inclusion. That's beautiful, right? That's great that we're talking about these things, but I'm worried that it's being co-opted by people who are using it to just keep the status quo going and not really change. So there are people in this world, thankfully not many, but I think they don't need to be exposed, but we need to take a more critical lens. Like, who is saying these things, but through their actions aren't doing it? And these aren't frontline people, because frontline people care. That's why they got into this work. They see the suffering that their clients are going through. They want to support them. So I don't ever blame frontline, because if they were just doing it for the money, there's just so many other jobs you can do that pay more and are not nearly as stressful. But I feel like there's people within these leadership positions that have spoken the language, but they're not doing it. And it's not just my opinion. I think over time, look at their actions, right? And and I love the fact that we are in this field doing more collaborative work. It's, again, it's slow. So maybe some of those folks are going to be conspicuous in their absence if they're not getting together. But anyway, that wish list is that we start to be, let's stop just talking about it. Let's actually look at the actions and who's doing the actions and then who's getting in the way of the actions. Because even again, I'm going to sound jaded, but I hear people say these little on maybe social media saying we need to work together, we need to collaborate, and that's lovely. But again, that's easy enough to say, but it takes work. And the empathetic part I have is I've been at these meetings where we all have said that, so I'm guilty of it too. And then we just go back and we're just trying to, like, we're treading water sometimes. We're just so busy that we know the value of collaborating, but we just aren't able to do it because we're just trying to manage day to day. But we have to find a way, right? Because it's hurting the people we're supposed to help. So we need to collaborate more. We need to call people out that aren't doing that. And we need to be willing to look at things on a systems level, right? And say, okay, this made sense 50 years ago. It may not make sense now. I say this again often. I go, the system was made by able-bodied white men, right? And it's not even necessarily working for that population anymore, right? So when I advocate for change, I'm going to say at change for the sake of South Asian communities, although I think the systems need to change and be adjustable to who they're working with. But I'm actually saying it's not just good for us, it's good for everybody. The system needs to change for everybody. And so, yeah, like looking at things with the systems lens, which I know a lot of people don't necessarily want to do because it's huge, right? It's a lot of moving parts. That's where true change is going to happen. And we are in a position in this part of the world to lead that, but too often we fail to do that.
Very well put together. And I echo what you said, because we live in a world where we have technological advancement. The world is growing exponentially. So you would think that everything would keep in pace with that. Quick question on the mental health topic. If you have to describe the difference between mental health and mental illness, how would you describe that? What are some of the key differences?
Oh, I always mix this up. So I might not be the best, but even like mental health to me is it's everything. It's what you do to maintain well-being, right? Sometimes we talk about mental health and only think it's for related to depression or mental illness, right? Like that we use the term synonymously and it's not, right? Mental health is about, even I say counseling is just one aspect of maintaining mental health, right? And that's an area, again, we will focus on because we've got the capacity to do that. But there's also healthy nutrition, healthy eating. There's like exercise, there's mindfulness, there's yoga. There's so many ways to maintain, well, there's connection, right? There's community connection, friendships, family, and those connections and the supports that can be provided there. To me, mental health is looking at things in a more holistic way, whereas mental illness is, yes, looking at the specific conditions that somebody may experience, like with depression, anxiety, schizophrenia, bipolar disorder, any of those and many more. And then looking at that and looking at ways to support that individual, whether again through counseling or through medication and many of those other things I just mentioned to also support their mental health.
So, say, for example, somebody is on the edge and they're not really sure if they need counseling or if they need support or who to go to. And what does the process look like for them? What does the person has to do first? Who does he engage? And what are the next steps from there on?
So my philosophy has been that 100% of us can benefit from therapy, that and everyone should explore it. The only reason that most people haven't is, again, how our system is set up, in that you're not going to, if you're otherwise doing okay, it's going to be really hard to access public sector system, right? Because it's very limited in terms of funding ultimately. And so it will often only support those who are frankly quite unwell, right? To whether that's in a hospital type setting, or again, you have to meet a certain threshold to even be able to access that. So that's the societal kind of thing that's been set up, right? And again, a very private system that again, I don't want to devalue the work those folks do because it's absolutely necessary and they absolutely deserve what they get paid. But again, it's not accessible to many. But 100% of us can benefit from therapy. I say to all of our therapists, all of our interns that they are welcome to access therapy and I would encourage it. I have a peer that's from another country and she said that's a requirement for therapists is that they see their own therapist, right? So part of that is making sure that they're doing the best work they can for their clients is they're taking care of themselves. And so even those that have great family connections and friends that they can talk to, I still think therapy is great. Like someone that doesn't you don't have this prior relationship. You don't have these sort of roles you've already established within your family or friendship networks. This is just someone that's completely non-judgmental and a certain unbiased third party, we could call it. And so anyway, the best thing to do is if you don't know is to reach out and see if you would benefit. We support we support people that were just released from the psych units of hospitals. And that again is telling of how under resourced our system is because we are not the best resource for that person. They need like a team, like a psychiatrist, psychologist, social worker, counselor, peer support. But often they're not going to get any of those and they're referred to us because hopefully I like to think our reputation that we will support them. Right. So we will get folks that are just maybe had a bit of a mental health crisis and got stabilized and they're still at that stage. And we're also getting people that are just maybe certain things are emerging. Like I wish our society and our systems weren't so reactive because that's the impression we give to our communities. Just come see us if you're a certain illness. But if you're too sick, we might not be able to help you. And if you're not quite there yet, then we might not be able to help. It's such a fractured, broken system in so many ways. And it frustrates me, as you can probably tell. But I think what we're trying to do is say, just come see us, right? We aren't funded by, again, those primary sources. We do ask, we have fees that we charge anywhere from $1 to $20 to see a student, but there's no proof of income required. It's all honor system. And if someone says, I can't afford to pay anything, I'm going to the food bank just to survive, then we're not going to charge them. And yet every dollar helps cover our costs. And so, yeah, I want everyone to have a therapist, right? I've seen a therapist. I know a lot of my friends and family have seen a therapist, but probably not as much as I wish there was more that could do that as well, right? Because we've often been socialized to cope in these other ways. Some that are very effective, like exercise, but others that aren't, like drinking or internalizing it and then physically becoming unwell. So mental health is health, and whatever we can do to support that vision, we're going to keep doing it.
So, a question on that, and this is around particularly the South Asian community and the stigma that lies around mental health and some of these issues that you work on. What is your understanding of these stigmas in South Asian communities? What are some of the challenges as they face today?
I take a bit of a different approach, and I guess they exist, but I find too often that the system will often use that as an excuse not to try. It'll be like, oh, they're not going to come out anyway. They're worried about stigma or what people will say, or is it shunned, those kind of things. And those exist, and we need to address those, and and the best way to do that is prominently talking about it. And like my Punjabi is not great, but I try to send people to go on to media, the Punjabi media to talk about these things, because I think if it's prominent in people's thoughts, then they'll realize that it's a lot more common. It's not just them, that there's a lot of people that are experiencing similar things. And yes, it exists, but too often it's been, again, an excuse not to try from the system side. Like they're not going to come anyway. And again, I challenge that because I think, yes, these systems are busy and they don't want to add to their workload, but I find it troubling and frankly offensive sometimes that these systems will reach out to our community for fundraising for various things. And the community is so generous. But when it comes to then supporting those communities around mental health and being, it's severely lacking. And again, these are my experiences where I brought these up when I was more in the system and I was often told, yeah, you're right, but we don't have anything in our budget this year. Try back next year. And then I would cut back next year and they would say the same thing. And then I'm like, okay, I get this, right? This is just a way to keep pushing it off. And I'm not saying they're being devious about it. Yeah, I accept that they have that. But again, that's not acceptable because this is a community that's suffering like all communities are impacted by mental health and substance use. youth violence and intimate partner violence, but just how poor the underserved South Asian communities are. It was offensive to me, right? There were certain things I observed that wouldn't have happened with the mainstream community, like the significant wait list in certain programs. And again, the excuse was, yeah, we just don't have anything yet. These other communities are getting supported. And like I said, anytime something is needed to support another issue, and I'm not picking on any system, but it's just our communities are so generous, and yet I don't think they're getting anything in return or very little in return when it comes to their needs. Having said that, I see in the last few years, it's been better, right? But that's after years of it being so severely lacking.
Yeah, yeah, I agree with you on that. And I think there's a lot of work that could be done within the South Asian community specifically if we talk about that. If I have to ask you, what has been a failure or an apparent failure that has set you up later for success? Do you have a favorite failure of yours?
Oh, yeah, absolutely. Lots. Yeah. Um, I'll share this. Like we even had space that was given to us at a good Dwada here in Surrey. And I appreciated it. I think there were some champions there. And then they moved on. And then some of the newer sort of executive was like, we need our space back. Right. And I was disappointed because we didn't even need the space. We had our own space, but I brought a lot of stuff over to that site because I really thought, wow, what a great message that people are going to the good Lord. I can see this mental health service right there, just off to the side of it there. And so that was the biggest, I thought, benefit to that. And yet they did the newer sort of executive. And again, I'm not trying to pick on anyone. It is what it is, but I don't think they saw the benefit. They saw different values for their space. So it felt a bit like a one step forward, one step back, but I still think it was overall a great experience. So those kind of setbacks where sometimes you could have a certain champion and if they move on and you lost that person, it can set you back a bit. But I didn't see it as too much of a setback. Even prior to that, even my whole career, social work program, I never got it the first year, many years, but we're talking about now around 20 years and or even more. But I didn't get in, but I didn't give up. And I started taking extra like courses that I needed to take anyway, because I was given permission. And so the next year when I applied again, I'd already taken a good chunk of those courses and then I was able to get in. So if it's something you want to do, be persistent, right? Sometimes it's not, you can do everything you can within your own power. And sometimes it's just not in the cards, but that doesn't mean to give up and just find a different way around it. And I've had a lot of those experiences. I've had going back to the other people that sometimes I think speak the rhetoric, but not the action. You still need to get out there and open yourself up because for that, time I've ever encountered someone like that, I've encountered a dozen people that were just like, yes, let's work together. Let's do this. And so I don't want to forget that either, right? It was this open approach where, yes, I may have been, it didn't end up going anywhere and I put a lot of energy into it. But in the end, I also had all these other relationships that really went far and are continuing to this day. Still be open about it. As much as I can sound cynical and jaded, it's not that. It's just, I just want people to also just keep their eyes open and be reflective of their experiences and not just accept what they're told, take a critical lens, but at the same time, be optimistic, right? I call what we do, it's a bit academic, but I call it pragmatic transformatism. Just a way too wordy, but pragmatic just means, yes, we're moving along slowly, but reasonably, right? Being pragmatic. Like it's me saying I want to be a millionaire tomorrow. And like, that's not pragmatic. You have to think that way. That makes small baby steps, but it's still transformative. So you can be both. You can make, I think, massive changes, but not think that it has to be done overnight.
Perfect. Let's talk a little bit about your background and your upbringing. You are a father now. You were brought up in Canada. In your experience, how has life changed from when you were growing up to now, and for good or for bad?
Oh, it's not so much bad, but I love that. And again, and maybe it was a small town thing, but I love the memories I have of just being able to get together with friends and make a few phone calls and you can all get together in 5 minutes. That it's not quite so easy to do in Surrey. So I missed that. My kids couldn't quite do it to the same extent, right? I value having grown up in a small town. I value parents that were very egalitarian in their approach. And I think it absolutely rubbed off on me. And by that, it wasn't the traditional kind of patriarchal, like father's in charge and has certain roles that they're supposed to do. And mom has other role, like more kind of home roles, we'll say. Like there was things my dad would cook. My dad would take me and my siblings to different events and different things. And I appreciate that because it's something that was very much instilled in me. And so I think that's great. The part that I think we all need to be concerned of as parents these days and just be on top of the social media and just the influence that can have, that we're still like we're unpacking just the impact that can have and so just being aware of that's even on us as adults how impactful it can be. So those kind of things. I think the fact that the technology we had and the knowledge we have at our fingertip is amazing. So that's great. So those are all good things. Yeah, I think the it's unfortunate even these days, like summertime, the wildfires and things like air quality, climate change, those are all things that we never had to consider growing up, right? Or even just recognizing, which is again, a beautiful thing, like just the recognition of mental illness and mental health. And like it's so much greater than it was when I was growing up for sure. So we definitely are going in the right direction. And yeah, I mentioned that I'm a father, I'm a son. I was also a spouse, and I am now a widow because my spouse passed away a few years ago. And so I too have been greatly impacted by mental health and mental illness and grief and trauma. And I'm still working on that and I'm still unpacking that. And yet I have resources, I have connections that allow me to manage my traumas in ways that I know a lot of people don't. So as much as it's been an impact on me, it also resonated for me the need to do what I and my colleagues are doing. And in many ways, I channeled my grief, which again, I'm still working on. It's a lifelong process, but to start to do some of the things I'm doing, like challenging things, like prior to that, I may have just accepted like, oh, that's our policy or that's our procedure. That's how we do things. But I don't do that anymore. I say, if it's not helping and if it's even maybe hurting the people we're supposed to help, then why are we doing it? So maybe I got frustrated by my own circumstances and my spouse's passing, but in many ways I was able to channel some of that into the work. And I was grateful in a weird way that I could do that I actually had a job or a position where I could do things that I was passionate about and actually felt that it was going to be impact.
I'm sorry to hear about that loss, and thank you for sharing that. My question to you on that is, given such an event occurred in your life and given the stressful job that you have, how do you stay mentally fit? What sort of frameworks or policies you have in your life that you go to make sure that you are always mentally proper, mentally fit, and be able to do the best work out there?
Great question. It was family, including my spouse's family, my family, the supports I had. There are days I struggled to get out of bed. So I'm so grateful that I had family to make sure the kids were up and ready for school and got to school for their time. I would have done it because they were my priority. Even they helped me so much in ways I can never describe, but just that focus on things. And as they got older, I realized, okay, like now I have more time in some ways. Some of the things maybe that I was pushing away, like my old traumas were starting to kind of, I could feel them. And again, I come from this field and I knew they were there, but I kept busy in many ways. And I don't think that's a bad thing. Again, this was focusing on the kids and their needs. And I know my spouse would have wanted me to do that anyway. That really helped, right? Staying connected to them, ensuring as much as, yes, I had this trauma, they obviously, of course, did too. They lost their mom. And so I needed to be there for them as much as I could. I've even said there's times when mentally maybe I wasn't quite there, but I did my best and I was physically there. But I also started to have the glass of wine. And then that turned into a couple and it turned into many. And again, when I knew this was not the best way to cope, it is what I needed in that moment until I had to step back and say, okay, this is maybe becoming problematic. And again, I was able to recognize that before it did really become problematic. And so even though again, I knew that's the pattern that people may turn to substance, and yet that's what I did because like, I understand why people do it. It helps to numb sometimes the feelings, but of course, when the nasha ends, it's right back and even stronger. But over time, once I got back to a bit of my own grieving process, which I absolutely needed to do as well, I got back to a bit of self care that as I get older, it's something I have to do regardless. But trying to get out to fresh air and doing the mindfulness and doing certain, I have certain little tools that help me with my breathing, being aware that even despite now several years have passed and I've been working on it, that I'm going to have good days and bad days and not to be too hard on myself. And even knowing that those will pass, right? Because I've gone through it enough to know these are all things that, make, and it's again, going back to what I look in our system, that there's a lot of people suffering. There's a lot of people that are traumatized. I think therapy can be great, but I also know talk therapy can actually re-traumatize somebody, or you can be doing it for a long time and you can hit a bit of a wall because it's not just that it's all up here, it's also physically impacting and it's also caught up in your body. And again, too much of our public system is about talk about it and do a few sessions. And again, it's limited, right? It's often 6 or 8 sessions, but a lot of people need 20, 30, 40 sessions, right? And so we don't cap sessions. That's public system because there's limited funds. And it's not going to meet the needs of a lot of these folks. And trying to incorporate even somatic therapy, it's called, right? These other kind of innovative therapies that's not all about talk, but how the mind and body is connected and how to regulate the body that's going to be impacted. So for myself, I would wake up in the morning and feel like I was on the verge of a panic attack. And a lot of it is I realized I can't change that because it's something happening almost subconsciously during my sleep. And so I just need to find ways to manage it. So sometimes when I have those days, it's the worst in the morning, but there's certain things I need to do to manage it. And then when I do that, I can take on the rest of the day. But there's days before that early on where it was just so debilitating that I just needed to stay in bed a little longer. But like I said, I had the kids to get can do as well.
Thank you for bringing us into that and sharing your insights there. Having gained all the experience that you have in your life, what advice would you give to your 20-year-old self and why?
Again, it goes back to that. Don't just accept what you're told, question things. Again, be strategic. Again, my young self might not have been able to challenge some of those things. But I also had some great mentors and managers. And what I appreciated was I was always someone who came up with ideas if I saw certain things. And again, sometimes they were told no. I was told no because so our mandate didn't allow it. But there was times when it was like, okay, yeah, let's give it a try. Always be willing to find different ways of looking at an issue and offering different solutions, accepting if it's not possible early on, but keeping in mind that the only reason it's probably not possible is these outdated policies and procedures. And maybe if I'm doing this for a while and I move up it into leadership, I can start to address those. So that thing, I wish I'd just been a little bit more cognizant of that. Something else, again, this sounds jaded, but I used to think, oh, okay, this person's a director of this or a manager of that. Now I don't care. It sounds harsh, but I want to see what you've done, what you've accomplished, right? I don't care about your titles. I respect even people that have got their master's and their doctorate. And I know there's a lot of work there. So I respect the work they put in, but that doesn't just confer that you're an expert or that your stuff in ways that others don't, right? So I respect the work they've done to get to that place, but I don't necessarily think that's warranted. I want to see what you've accomplished and I will respect your actions. I don't respect words if there's no action involved. So that's me. I'm not saying everyone has to be that way. And like I said, as much as I may come off jaded, I'm always very optimistic. I will meet with anyone anytime if they want to talk about what's going on for them and some ideas they have, if it's potentially going to benefit the people we serve and support.
Perfect. Yeah. Actions speak louder than words. So I'm with you on that. What is your most favorite book and why?
You know what? I'm not the best reader, or I've certainly fallen off. I'm reading a book on clinical supervision right now just because I want to always continue to ensure that I'm doing the best work there for students. I'm going to say a graphic novel, which they just adapted last year, a couple of years ago, called The Sandman by Neil Gaiman. And I love him as an author and I love fantasy and I love that creativity. And when I even like in terms of, I love with my sons read anytime there's a new Star Wars or it hasn't been a while, it's been a while, like Lord of the Rings, those we were definitely going to go or any of the superhero movies. They're getting a bit much sometimes perhaps, but I love that creative creativity behind those, right? And yeah, with the Sandman, it was just a very imaginative series that I really appreciated. Just the thought. He incorporated elements of Greek literature, and I've always been fascinated by some of those stories, even in art, our culture, like those stories that often have morals to them, but they're not so blatant morals, but they're tales about some learning or some lessons. And in some of the Greek fables, I think were like that as well. And yeah, I'll say the same.
Perfect. I'll be sure to check that out. And if you can put a message on a big billboard for every Canadian to see, what would that message be?
Right. Like again, getting to the work that everyone should see a therapist, and or therapy should be accessible, or universal mental health. Sorry, there's a few of them there, but something like that, right? Or even my favorite quote is the Margaret Mead quote, and it's I'm going to mangle it a bit, but it's never doubt that a single person or small group can't change the world, because indeed they're usually the ones that do. That's not even anyone else. But the idea being like sometimes we think these issues, whether it's mental health or climate change or domestic violence or what, so many of these issues are so big that it's beyond our scope. And it's not, right? There's an impact we can all have in that regard. Not everyone needs to be a counselor or social worker, but if we all learned a little bit more about those things, then we might better at identifying when we're struggling, or identifying when a loved one or a friend is struggling, and be able to connect with them and just let them know that we're there to talk, right? Those kind of things. Like a quote like that says you don't need to be in any, even with, like I said, those positions of authority. Sometimes those folks are the ones that maintain the status quo and keep things the same, even though we know things need to change. Don't think you can't make an impact, right? You absolutely can. And that can even be an impact within your circle, your family, your friends, or it can be at a community level. And all of those are incredibly important. Will have incredible impact.
Absolutely. I believe change begins at home. Every little bit counts to make a big impact. Thanks for that. Just final questions here. What does the future hold for moving forward, family services and yourself?
For the agency, it's just as much as we've grown immensely and we are reaching a huge population, there's a lot of folks that still don't know who we are and what we do. And so I hope to continue. I ordered a bunch of shirts, and we got folks doing community outreach with the logo and stuff, and just so people could approach them and they can talk to them about what we do. That's another part of it, right? This idea, like, just come see us, we're open. That's not reaching a lot of people, especially because when they do often come, they're turned away anyway, or put on a wait list, going back to what I said. But we won't do that. So we are out there, and we'll continue to be out there. We'll continue to grow. We went from regional to provincial to national, and we'll continue to go that way. And hopefully developing partnerships and relationships that we've got about 15, 20 agencies we already work with. Hopefully businesses want to work with us, because if they can invest in their staff's mental health and well-being, what they're going to find is that they're going to have more productive staff, right? And they're going to have less absenteeism and less turnover. And so if they're just even looking at it from a business model, it makes sense to invest in, because for every dollar they invest, they're going to get like 10 times as much back in return. And so it's just continue to growing the model, which I think is very unique. I've heard people say, I've never heard this. A lot of agencies might take a student or two, but not 125. And again, the model that doesn't require a lot of funding to operate, like we operate basically on 3 or 4 positions. People call the number, that's still my number, right? I'm doing a lot of the admin work, and I don't mind, because I've got it down to a pretty good system. And so that's what I'm looking at. But at the same time, I feel like we need to invest in not just us as an agency, but these more creative, innovative approaches to address an issue, because we spend decades and decades saying we need to deal with mental health, we need to deal with substance use. There's a lot of good happening, but I feel like those systems are limited ultimately, and aren't going to be able to anywhere come close to what the need is. And so let's look at alternative models that are, the students come to us, not, I think, because we offer so much opportunity. We offer lots of training. We offer lots of flexibility. We are a 7-day operation, so they could still work during the week where they have their schooling and do some weekend work, or later in the day type of things that most systems don't do. They're mostly Monday to Friday, 9 to 5. And so we have to look at alternative models to address these kind of issues. And then for me, it's just continue to work on my healing. And I couldn't even talk about these things a few years ago without breaking down and just not being ready to do it. So I know I'm trending in the right direction, but I have to stay on top of that. And then being open about it, right? Saying, here I am running an agency and I'll be the first to admit I've had many struggles and I've even gone sideways in some ways. And yet I found my way back. And just to normalize that we all are impacted. And we as in particular, even we as men need to speak up about this is most of our clients are female. The numbers of men coming to us has risen and that's great to see, but that's still an area that we could do better. And then even South Asian men, maybe we can start unpacking some of the impacts we've had on some of those, the more traditional values. Because I even say that impacts us as men. We think we can only be stoic and we can't talk about our emotions. It's actually limiting our abilities just as individuals. And then if we're parents, if that's what we think that we aren't supposed to show emotion, I think it's really limiting who we are. And so we need to keep unpacking that.
Thank you for sharing all that. It has been a pleasure chatting with you today, learning from you about all the great work you are doing and your organization is doing. I hope the listeners would take some lessons out of this conversation today and be able to apply that into their daily lives and make a change in their daily lives or their loved ones. So I appreciate all your time. Any final comments on your side to go?
If people go on our website and they want to email, they find the email there. It comes to me. Everything comes to me. Or my email is Gary, Gary at movingforward.help. My number is 778-321-3054. People are welcome to reach out, whether they want to access services or they have some thoughts or ideas. And I'll say I don't answer the phone because it rings because it is an office meeting agency number, but please leave a message and I will follow up or have one of our folks follow up if they're looking to access services.
Awesome. Thank you for that. Thanks for your time.